We have had today a wonderful meeting with the patient organizations, all together to create a bridge between ESOT, patients and health professionals. This meeting is needed because we need to create a platform for the patients that they can find a place to represent their voice and to start to communicate with us as health professionals and to start to interact all together for a better success of their treatment. They should become more self-confident on being responsible for their own care and their own treatment, but as well to help to other patients to be involved in all the process. The benefit for health professionals, there is a lot, because we need to start thinking more on patients as they have their ownership of their own health. And the voice from the patients is essential for us, because when we do research, when we do any clinical trial, or where we would like to develop a new tool for transplantation, we always need to the recipients of the organs that we are going to transplant. And this is the need that we have to start discussing and involve them inside our organization.
This meeting is important. It's probably the first time it's ever been done this way, but it's a really good idea to get the patient associations together to talk about how transplantation can be improved, but how the patient view on that can work with the professional view to come up with something maybe new, something better to improve transplantation and outcomes for the future.
We have discussed many different relevant things today about organ transplant, or about waiting lists, and about diseases in many different ways. So I'm happy to be here.
I think the most important takeaway from this meeting so far has been very much about patient involvement and patient empowerment, and that actually, yes, there's quite a lot we can do as patients, but I think the support of our transplant teams, so the nurses as well as the surgeons, to learn about what we can expect if we have a transplant, and also what the future might mean to us. So whether it's psychosocial support or whether it's the medical outcomes, those things are equally important to patients, and being able to have surgeons work together with us to share those views has been very revealing.
The most important thing is that in different countries there are different practices. And the aim of today is to make an inventarization of that, and hopefully that's the first step to come to a more equal system throughout Europe.
The three main results of the meeting are: we have created a platform, a network of people, patient associations, health professionals, and all together we have more things in common between all the organ recipients than differences. The second point is that we need to create a common voice to be represented inside the European Commission, inside all the competent authorities, to the health professionals and to the scientific community, to give them voice to be able to talk. And as well as health professionals, we need to have a platform to interact with them in a platform that protects their rights and facilitate the communication with them.